more than 1 in 7 adults has chronic kidney disease? Kidney health is often overlooked despite it silently playing a pivotal role in our overall well-being. Healthy kidneys filter about half a cup of blood every minute, removing all waste and excess water through urine. Kidneys also help regulate blood pressure and even produce essential hormones. When kidneys don't work properly, toxins and waste can accumulate, excess fluid can build up, electrolyte imbalances, high blood pressure, and many other complications can occur. If left untreated, kidney dysfunction can progress to end-stage renal disease, or ESRD in short, where the kidneys lose most of their function. ESRD requires treatment, such as dialysis or kidney transplantation, to sustain life. In fact, kidney disease ranks among the top 10 causes of death in the U.S. So, the big question is how to take care of your kidneys. We all know that eating healthy foods like vegetables and fruits is essential for well-being. However, not all healthy foods are suitable for people with kidney concerns. Some foods can be high in phosphorus, potassium, salt, sugar, and oxalates, which pose risks if the kidneys aren't in top shape. So, which healthy foods are friends or foes for your kidneys? If you've ever wondered, you're in the right place. In this video, we'll discuss 7 usually healthy foods that can actually harm kidney health. We also offer tips on how to still enjoy these foods, or suggest delicious alternatives without affecting kidney health. By the end of this video, you'll be armed with the information you need to keep your kidneys healthy. Before we dive in, kindly note that all information you'll find in this video is fact-checked, unbiased, and reviewed by qualified professionals. Alright, it's time to swing back to the healthy foods that can destroy your kidneys. 1. Avocado. Avocados are creamy, delicious, and undoubtedly healthy. They are rich in monounsaturated fats, vitamins E, K, and C, and minerals. But if you have kidney issues, you might want to watch your avocado intake. The main issue with avocados is they're pretty high in potassium. Potassium is usually great for keeping our body in balance. It helps with our blood pressure, nerves, and muscles. Normally, our kidneys do a great job of managing extra potassium in our blood. However, in folks with kidney issues, their kidneys can't remove extra potassium effectively, causing too much blood potassium, a condition called hyperkalemia. If hyperkalemia is left unchecked, it can cause serious issues for the heart and muscles. Guidelines for kidney disease often suggest limiting potassium, but the exact amount varies. So, it's best for kidney patients to talk with their doctor to determine their ideal potassium intake. People on potassium-restricted diets usually aim for less than 2,000 to 3,000 milligrams of potassium per day. An average avocado contains about 975 milligrams of potassium, which is roughly 33 to 48% of this amount. More concerning, despite being full of nutrients, avocados are also high in calories. One fruit can have over 300 calories. So, eating too many avocados can lead to weight gain, a risk factor for kidney disease. Simply put, being overweight puts more strain on your kidneys, making them work harder to remove toxins. Plus, being overweight increases your risk of developing diabetes and high blood pressure, the 2 leading causes of kidney problems. After all, if you have kidney issues, it's wise to watch how much avocado you eat. A good tip is to enjoy just a quarter of an avocado at a time. This helps you reduce potassium intake while still reaping its nutrient benefits. You can also mix it with other low-potassium foods, which we will mention in the next section. Another trick is to peel, Chop and soak your avocado in water for 2 hours or boil it. This trick can help slash potassium by up to 50%. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 2. Oranges. Oranges are healthy citrus fruits, rich in vitamin C, antioxidants, and fiber, which are all great for our health. But oranges may not be good for people with kidney problems due to their high potassium levels, similar to avocados. A medium orange, which is roughly the size of a small fist, contains around 237 milligrams of potassium. This amount may not seem significant, but eating more than 1 orange a day or drinking orange juice can easily exceed your daily potassium limit. 1 cup of orange juice can have around 496 milligrams of potassium, which means drinking 500 milliliters, or about 1 pint, could contain 1240 milligrams. As we discussed with avocados, regularly eating potassium-rich foods like oranges can worsen hyperkalemia in people with chronic kidney disease. Hyperkalemia can make you feel weak, numbed, tired, and nauseous. In severe cases, hyperkalemia can even cause irregular heartbeats or cardiac arrest. Moreover, eating too many oranges could increase your risk of kidney stones because oranges are high in oxalates. More details will be provided in the next section. Orange juice contains fewer oxalates than whole oranges, so you can still enjoy a glass occasionally. For a safer choice, consider making juices from fruits with less oxalate, like berries, pears, cherries, apples, and grapes. The bonus is that these fruits also come with less potassium than oranges. 3. Almond. Almonds are a popular and nutritious snack packed with fiber, vitamins, minerals, and healthy fats. However, eating almonds can increase the risk of kidney stones, especially for people with a history of kidney problems. This is because almonds contain high levels of oxalates. 100 grams of almonds, which is equal to about 3 small handfuls, contain about 469 milligrams of oxalates. Normally, oxalates bind with calcium and leave our bodies in the stool. But if we consume too much oxalate and not enough calcium, oxalate can be absorbed into our blood. Then, it ends up in our urine. If your kidneys don't function well, or your urine is too concentrated or acidic, the oxalates can bind with calcium in your kidney, forming crystals that grow into stones. These are known as calcium oxalate stones, which make up over 80% of kidney stones. The quick buildup of oxalate stones in the kidneys is called acute oxalate nephropathy. This condition can damage the cells of kidney tubules, resulting in acute kidney failure. Research has found cases of oxalate nephropathy linked to peanuts, which have about 187.0 milligrams of oxalates per 100 grams. Almonds have 2.5 times more oxalates than peanuts. So, should you avoid almonds altogether? Not necessarily, but it's a good idea to enjoy them in moderation, just 1 or 2 handfuls a day. Also, cashews, peanuts, pistachios and walnuts are high in oxalates, although in smaller amounts compared to almonds. So it's best to practice moderation with them. For detailed guidance, it's always best to consult with your doctor. 4. Spinach. Although leafy greens like spinach are praised for their health benefits, their potential risks are often overlooked, especially for kidney health. The main issue here is spinach's oxalate content. Oxalates can crystallize and form kidney stones, causing intense pain, blood and urine, nausea, vomiting, and kidney damage. A serving of 100 grams or half a cup of spinach can pack up to 2,350 milligrams of oxalate, which is higher than many other leafy greens. In a study, scientists watched what nearly 240,000 people ate over many years. They found that spinach made up over 40% of these people's total oxalate intake. Other foods like cassava root, amaranth leaves, chard, beet leaves, star fruit, and rhubarb also contain high levels of oxalate, so it's wise to avoid them if you have kidney concerns. Coming back to spinach, it is also high in potassium. 100 grams of uncooked spinach can contain up to 558 milligrams of potassium. As we mentioned in the avocados section, in folks with kidney disease, their kidneys may struggle to filter potassium. So, if a kidney patient eats too much spinach or potassium, they may suffer from hyperkalemia, a condition damaging their muscle and heart. Note that boiling spinach doesn't reduce its potassium or oxalate content like it does with avocados. So, while spinach is indeed a superfood, you should eat it in moderation to fit your state of health, whether you have kidney disease or not. You can still include spinach in your diet by balancing it with other low oxalate and low potassium vegetables like kale, carrots, zucchini, lettuce, cabbage, broccoli, and cauliflower. 5. Whole wheat bread. Lately, many folks believe that whole wheat bread is healthier than plain white bread. Whole wheat bread stands out for its vitamins, minerals, and fiber. But for kidney health, the preference should lean towards white bread. This preference arises from the elevated levels of phosphorus and potassium in whole wheat bread. As we explained in previous parts, high potassium foods are not good for kidney patients. Phosphorus is another concern. Actually, for people with healthy kidneys, phosphorus isn't usually a concern because the kidneys filter out excess phosphorus from our blood. But for those with kidney disease, it's a different story. Their kidneys can't filter phosphorus effectively, leading to high levels in the blood. This can pull calcium from your body, making your bones thin and weak over time. Then, you might have symptoms like itchy skin, muscle cramps, bone, and joint pain. A single slice, or just 28 grams, of whole wheat bread can contain around 67 milligrams of phosphorus and 81 milligrams of potassium. It seems like it's only a little, but most people don't stop at just one slice. If you're crafting a sandwich, that's double the amount. In contrast, a regular slice of white bread carries about 64 milligrams of both phosphorus and potassium. Other foods that are high in phosphorus include dairy, whole grain bread, bran cereals, oatmeal, nuts, and sunflower seeds. Since there's no set daily potassium intake for people with kidney disease, it's important to consult your doctor or dietitian to find the right amount of these foods for you. It's not just about phosphorus that makes whole wheat bread a potential problem for your kidney health. Bread can worsen the effects of kidney diseases like anemia, where you have a low red blood cell count. Simply put, kidney disease affects the absorption of important nutrients like iron, which are crucial for making red blood cells. Whole wheat bread contains phytates that bind to and reduce further iron absorption. Therefore, whole wheat bread can worsen anemia in people with kidney diseases. Another concern is that commercially produced bread contains added salt and sugar to enhance flavor and texture, which isn't good for your kidneys. A diet high in salt and sugar can raise blood pressure, a major risk factor for kidney disease. High blood pressure puts extra strain on the kidneys. Over time, this strain can lead to kidney damage. 6. Cocoa. Cocoa offers benefits for mood, brain, and heart health, and may even assist with diabetes. However, kidney patients should notice that 100 mg cocoa powder contains mg of oxalates, which is very high. Cocoa is also high in phosphorus, which is not good for kidney patients. High phosphorus levels can lead to dangerous calcium deposits in blood vessels, lungs, eyes, and heart. Over time, this can cause hardening of the arteries, increasing the risk of heart attack, stroke, or death. Cocoa-based treats like chocolate, chocolate milk, and chocolate syrups are also rich in oxalates, phosphorus, and potassium. These products often come with added salt and sugar, which can strain your kidneys even more, like we discussed earlier. Some people think that the caffeine content in cocoa beans makes you urinate more and may lead to dehydration or calcium loss, raising your risk of kidney stones. Yet, studies show the opposite. If you want to strike a balance while enjoying your cup of chocolate milk, moderation is key. You can opt for drinks with lower oxalate content, such as juices, milk, or simply water. You can also consider using carob powder as a substitute for cocoa powder for kidney health. Carob generally contains lower levels of oxalates than cocoa, and it has the same flavor. Plus, compared to cocoa, carob has 9 times less phosphorus and 3 times less potassium. However, if you are on a low oxalate diet, you will most likely have to leave cocoa and other high oxalate foods behind until your body heals. 7. Bananas. Bananas are a good source of vitamin C, magnesium, and fiber. Above all, this fruit is renowned for its high potassium content. A medium-sized banana, about 7 inches long, contains roughly 422 milligrams of potassium. That's 14-21% of the daily limit recommended if you have kidney disease. This may seem small, but people often eat multiple bananas at once due to their low calorie count and delightful flavor. Then, blood potassium can quickly add up, triggering hyperkalemia in kidney patients. This can lead to weakness, numbness, fatigue, nausea, irregular heartbeats, and in severe cases, cardiac arrest. To manage your potassium intake, you can start by choosing smaller bananas and limiting yourself to just one a day. Here's another tip. Boiling or soaking bananas in water briefly can reduce their potassium content. However, this method may also wash away other vitamins and minerals. If you love the taste of bananas, consider blending them into smoothies or juices with fruits lower in potassium. Good options include apples, berries, cherries, grapes, pineapples, watermelon, pears, plums, and peaches. They can help you maintain a balance between flavor and kidney health. It's important to note that other fruits like cantaloupe, apricots, honeydew, and dried fruits, such as prunes or raisins, are also high in potassium. Therefore, it's wise to consume them in moderation for kidney health. And there you have it, folks. Our list of 7 healthy foods to avoid or limit if you have kidney issues. They are avocados, oranges, almonds, spinach, whole wheat bread, cocoa, and bananas. It's important to stress that while these foods can be bad for an unhealthy kidney, most of them have their place in a balanced, nutritious diet. So, it's all about balance, variety, and moderation, especially for people with kidney problems. If you're worried about your kidneys, it's wise to talk with your doctor or a dietitian for personalized guidance based on your health and dietary needs. In the end, remember that your daily limits are for sodium, potassium, oxalates, and phosphorus. For listening. All foods have good and bad elements, so making smart food choices can greatly support your kidney health and overall well-being. Enjoy your meals in sensible portions and live a happy, worry-free life. Now, we want to send a big thank you to all our current subscribers and watchers. Your support inspires us to continue sharing valuable content. To explore more foods that can destroy your kidneys fast, check out the video on the screen. Some of the foods mentioned here may already be in your kitchen. We'll also share tips for enjoying these foods while keeping your kidneys safe. Stay informed. Stay healthy. Eat these 6 natural foods every day after turning 50. After turning 50, it's hard to ignore the changes in your skin, weight, memory, and energy levels. If you're under 50 and think you'll deal with it later, that later can be daunting. By taking steps now, you can avoid the need for a cure later. It starts with including superfoods into your daily routine. But before we get into that, let's first understand how your body changes as you reach 50. First, it's easier to gain weight and face higher healthcare costs. For people with severe obesity, the costs will skyrocket. A 2021 study from Harvard School of Public Health shows that healthcare costs are higher for women and people aged 60-70. One reason is that your body has more fat settling in, disrupting muscle quality. If you don't eat enough protein, you may face a higher risk of malnutrition and muscle problems like sarcopenia and dynopenia. Sarcopenia is when muscle shrinks and muscle mass declines. Dynopenia is the loss of muscle strength. Dynopenia develops at a rate 2 to 5 times faster than sarcopenia. Both can reduce your stamina and balance, increasing your risk of falls and fractures. Besides muscle loss, neuron loss and neural damage becomes common after age 50. Damaged areas release neurofilament light, or NFL in short, protein into your blood and cerebrospinal fluid, the fluid around the brain and spine. NFL is a biomarker for nerve damage and degeneration. Simply put, higher levels of NFL indicate more nerve damage, which can result in Alzheimer's disease, Parkinson's disease, Huntington's disease, ischemia, or memory loss. So, monitoring NFL levels can give you insight into what's happening with your nervous system. A 2020 study published in Nature suggests that after age 50, the levels of serum NFL increased significantly. In the 50-60 age group, serum NFL levels increase by around 2.7% a year. For people over 60, the increase is even higher, up to 4.3% annually. This is what aging does to your body on the inside after 50. So what about the outside? Your skin slows down in renewing cells, produces less oil, and becomes drier. Thus, your skin gets thinner, revealing more veins and bones. Healing from scratches or bumps takes longer. Pores may look bigger, as dead skin cells build up more. The buildup of oils and dead skin cells also result in white bumps near your eyes, called milia. Sun exposure isn't just about getting a tan anymore. It can cause more pronounced wrinkles, dry skin, age spots. It may also lead to rough, scaly patches. Although these changes are common as we age, they could be a strong signal that it is time to adjust your diet. The saying, "You are what you eat," certainly rings true here. Therefore, be mindful of what you're putting in your body and eat more anti-inflammatory and antioxidant foods. Healthy food choices can lower the risk of common age-related issues like muscle loss, neuron loss, skin aging, obesity, heart disease, and diabetes. That's why we've compiled a list of top 6 natural superfoods when you reach 50 to keep your mind and body in a good shape. Before we dive in, kindly note that all information you'll find in this video is fact-checked, unbiased, and reviewed by qualified professionals. Alright, time to swing back to the first must-eat food after turning 50. Yogurt. Many older adults are missing out on calcium and vitamin D, along with key probiotics to support overall health. So, when you reach for probiotic-rich yogurt, know that you're treating yourself to a nutrient-rich feast. Products with calcium and vitamin D work wonders for bone turnover. Observational studies also suggest that people who drink fermented dairy products, like yogurt and kefir, seem to have a lower hip fracture risk. A glass of milk or a cup of spinach also gives you a great amount of calcium. And yogurt comes from milk. In a study of over 8,600 postmenopausal women and 306 men, all over 50, they found some interesting results. People of both genders who have milk every day have an 8% lower risk of hip issues than those who have milk less than once a week. Yogurt and milk are also rich in high-quality protein, essential vitamins and minerals, making them especially beneficial for people over 50. Depending on your own needs and preferences, you may want to consider almond or oat milk, especially if you're sensitive or allergic to dairy. These milk alternatives are also rich with vitamins and minerals. Berries. Studies shout out loud. The more fruits you eat daily, the less likely you gain weight. So, after turning 50, eating berries is like teaming up with nature against weight gain while enjoying each bite. Berries have been traditionally used for skin protection against wounds and UV damage. This can help prevent skin problems after 50. Berries are also packed with antioxidant and anti-inflammatory compounds. Like fibers, vitamins A, C, and E, plus B-complex vitamins. Oxidative stress and inflammation are the troublemakers in aging brains, causing neurodegenerative diseases. Compounds such as epicatechin and quercetin in berries can fight these troublemakers, offering protection against brain aging. Animal studies also found that extracts from strawberries and blueberries can slow down memory loss. In a 2022 review of studies on older people, it was discovered that consuming berry-based products can improve brain activity, memory, processing speed, and attention. To wrap up, berries are rich in antioxidants like epicatechin, promoting weight loss and skin health. Berries have also been shown to combat memory loss, particularly in people aged 50 and older. Enjoying our videos so far? Drop a like to let us know you want more content like this. Yams. Yams are packed with vitamins A and C, minerals, and antioxidants that help fight aging. Yams are also full of fiber, which is important for digestion and metabolic health. Fiber can help lower the risks of obesity, diabetes, heart disease, and cancer, especially as you get older. A 2020 study on mice found that Chinese yam polysaccharides, or CYP in short, may improve learning abilities and help recover spatial memory deficits. In this study, CYP also lessens tissue damage in the brain, liver, and kidney of mice by reducing oxidative stress. Simply put, CYP can boost important antioxidant enzymes, such as superoxide dismutase, or SOD in short, catalase, or CAT in short, and glutathione peroxidase, or GPX in short. These enzymes work together to reduce oxidative stress. In an older study, yam extracts increased skin hydration by 39 to 46% compared to a placebo cream. The extract also promoted the growth of human skin cells. In short, yams are great for people aged 50 and above, as they can help reduce the risk of metabolic diseases, improve brain function, and enhance skin health. Spinach. Spinach is a rich source of folate and flavones, which can help fight cancer and heart disease, common diseases in older people. Spinach is also packed with vitamins A and C, which boost collagen and help protect skin from aging. Plus, studies suggest that spinach contains flavonoids, which can reduce oxidative stress and inflammation in the brain, improving brain function, especially in older adults. Spinach is also a great source of fiber that helps reduce inflammation, combating aging. Simply put, fiber feeds good bacteria in your gut. Thus, eating more fiber can help diversify gut bacteria, leading to higher production of anti-inflammatory compounds like butyrate. Studies also show that adding 10 grams fiber daily can reduce the risk of death from all causes by 11%. Red spinach takes the spotlight for your skin, as research in rats found a link between red spinach extract and enhanced skin color, hydration, collagen, and elasticity. Note that spinach is high in oxalates. Oxalates can combine with calcium and other minerals, forming tough crystals that increase the risk of kidney stones. This combination also makes it tough for your body to absorb calcium and other minerals. So if you have kidney problems or osteoporosis and need more calcium, it's best to skip spinach. In brief, spinach helps prevent cancer, heart disease, and boosts brain and skin health, making it great for people over 50. Just be careful if you have kidney problems or osteoporosis. Ginger. Ginger is a potential anti-aging medicine and a natural pain relief remedy embraced by the elderly. Ginger acts like a protective barrier against oxidative stress and inflammation, the culprits behind aging and degenerative diseases. Now, what's its secret? Ginger is high in gingerol and chagal. These compounds offer protection against gut and brain diseases, bacteria infections, diabetes, and even cancer. Ginger extract also packs a dynamic trio of antioxidants, SOD, GPX, and CAT, to beat any metabolic diseases. In a study from 2022, older women with high blood pressure included ginger in their diet, at a dose of 75 mg per kg of body weight per day. Within just 30 days, these women experienced lower blood pressure and fat levels, potentially lowering the risk of heart disease. And if that's not impressive enough, ginger can slow down inflammation by reducing the production of inflammatory markers like ROS, COX-2, TNF-alpha, Illinois beta, and HSCRP. Ginger can act as a brain protector thanks partly to its polyphenolic compounds. A 2019 review study has proven ginger's anti-aging benefits for memory loss related to amnesia and Alzheimer's disease. Plus, ginger shows promise in treating arthritis by fighting inflammation in osteoarthritis and rheumatoid arthritis. It is especially effective for relieving stiffness and pain in knee osteoarthritis. Overall, ginger is great for people over 50, thanks to its anti-aging compounds like gingerol and chagal. Plus, it can help improve heart and brain function. Fatty fish, such as salmon and tuna, are high in muscle-building nutrients, such as protein, vitamin D, and omega-3 fatty acids. Muscle loss is a significant health concern as you age. Older adults need more protein to balance nitrogen level and muscle mass. If you are over age 65, aim for a daily intake of 1.2 grams per kilogram instead of the usual 0.8 grams. You can easily get this amount from fatty fish like salmon and tuna. A study suggests if you eat about 150 grams of fish twice a week after 5-10 weeks, you can see a significant increase in hand grip strength. Another secret to aging well is vitamin D, which helps fight harmful fat effects and boost muscle growth. Salmon is a great source, with 4 ounces providing about 760 IU of vitamin D, or roughly 95% of your daily needs. Plus, salmon and tuna are good sources of omega-3 fatty acids, particularly EPA and DHA. Omega-3 fatty acids from fatty fish can also be an easy and affordable way for age-related muscle decline because they support protein building, muscle mass, and muscle function while fighting inflammation. Additionally, omega-3s and monounsaturated fatty acids are a powerful combo to fight insulin resistance and fat issues when you reach 50. In a 2019 study, higher fish consumption is linked to a lower risk of dementia in elderly people. Most organizations recommend that healthy adults consume 250 to 500 milligrams of EPA and DHA combined daily. You can get this by eating about 8 ounces of fatty fish per week. To sum it up, once you hit 50, it's critical to adapt to the changes in your body. And that starts with what's on your plate and off your plate. Beyond food, ensure you're getting quality sleep, intentional movement, managing stress in constructive ways, and connecting with loved ones and nature. These factors are also significant to vitality. And to age gracefully, it's best to avoid drinking and smoking, as they can lead to premature wrinkles. The small choices you make today pave the way for a smoother future. When it comes to your diet, if you want to maintain muscle mass and strength, try yogurt, milk, and fatty fish, like salmon and tuna. Veggies and fruits, such as spinach and berries with their vitamins and antioxidants, can fight inflammation for smooth skin, sharp minds, and healthy hearts. Yams and gingers are also great for easing pain and memory issues. Give them a try and see the positive effects on your health and energy. I'm sure the list could be longer, and I invite you to add to it in the comments section. Eat these 8 herbs to boost kidney cleanse and detox. The beneficial effects of herbs on kidney function are increasingly being noticed, particularly in conditions like diabetic kidney disease or kidney disease caused by diabetes. This is attributed to specific antioxidants found in herbs, such as polysaccharides, flavonoids, xanthines, and peptides. These compounds also have demonstrated potential in cleansing your kidneys. Simply put, their antioxidants help cleanse your kidneys from harmful molecules called free radicals, the major causes of kidney disease. When we eat or live unhealthily, our kidneys can become overwhelmed with toxins like heavy metals or free radicals. These toxins accumulate for years, so forget about any 3-day routines or fancy supplements for kidney cleansing. These methods can be risky and offer little, if any, help. We covered this topic extensively in our previous video, so we highly recommend you to check it out for more details. And for now, the best thing you can do for your kidneys is eating more antioxidant-rich foods like herbs. Herbs can also address prolonged high blood sugar, drug toxicity, and oxidative stress, which are common factors associated with kidney injury. Plus, herbs are effective in lowering blood pressure and enhancing cardiovascular functions, all of which are often compromised in chronic kidney disease, or CKD in short. Note that excessive salt intake has been linked to kidney damage. Hence, exploring alternatives to traditional seasoning becomes crucial for your kidney health. Herbs with their diverse flavors and kidney benefits, as we've just discussed, can serve as excellent substitutes for salt in cooking. We're here to help you explore the top 8 herbs that can help with kidney cleansing, how they benefit kidney function, and how they keep your kidneys cleansed, healthy, and robust. These herbs can also lighten the load on your kidneys, keeping them clean from the beginning. And the best part? They're delicious and easy to add to your meals. Before we dive in, kindly note that all information you'll find in this video is produced by humans and for humans. You can visit our website at healthtoday.com to see our advisory board and the team behind these videos. We do not use artificial intelligence writing tools like ChatGPT to automatically generate content. Be assured, our information is thoroughly fact-checked, unbiased, and reviewed by qualified professionals. Alright, it's time to swing back to the herbs that can help cleanse your kidneys. 8. Dandelion. Dandelion, or Taraxacum officinale, a member of the Asteraceae family, grows abundantly across the northern hemisphere in various environments. 8. Dandelion. This plant is not just a weed, it is known for versatile health benefits and abundant bioactive compounds, particularly antioxidants, such as sesquiterpene, lactones, phenolic acids, and inulin. Antioxidants can help neutralize harmful free radicals in the kidneys, safeguarding your kidneys from free radicals and oxidative stress. Some common antioxidants in dandelions, such as sesquiterpene, lactones, and phenols, also have anti-inflammatory effects. This property helps relieve kidney-damaging inflammation and foster optimal kidney function. Dandelion is also packed with a rich array of vitamins, minerals, and phytochemicals. Medicinally, with its bioactive ingredients, dandelion is highly valued for its contributions to kidney, liver, and gallbladder health. A 2010 study in the International Journal of Immunopathology and Pharmacology examined dandelion extract for its antioxidant and protective effects against induced oxidative stress. The extract showed notable effectiveness against free radicals and oxidative stress. These findings suggest that dandelion can aid in kidney cleansing as part of herbal formulations. Moreover, dandelions act as natural diuretics. Aiding more urine production, this helps kidneys flush out toxins and waste from your body. However, due to their diuretic effect and high potassium content, dandelions are not recommended for patients with severe chronic kidney disease. Still, dandelion enjoys global recognition in culinary traditions, featuring in salads, soups, and even wines. Its leaves can be enjoyed raw or cooked, and its roots and flowers are used for teas. Dandelion is considered safe by the U.S. Food and Drug Administration, or FDA in short. However, some people might be allergic to certain dandelion compounds, which could cause a skin rash or, rarely, an allergic reaction. If you're allergic to honey or plants like ragweed, daisies, chrysanthemums, sunflowers, or marigolds, it's best to avoid dandelions. Traditional Chinese medicine also suggests that dandelions are not good for people sensitive to cold. Note that too much of anything can cause adverse effects, but it is uncertain how much dandelion is unsafe. So, it's wise to begin with a small amount and see how your body responds. If you have any more concerns regarding dandelions as well as other herbs, we provide precautionary information at the end of this video. Make sure to check it out because this information is important. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 7. Parsley. Parsley is a staple in culinary traditions worldwide. This biennial plant is from the Apiaceae family. Anise, celery, fennel, and carrot are also part of this family, which has distinct flowers arranged in umbels. Regarding parsley, this herb's essential oils are rich in antioxidants, such as flavonoids and polyphenolic compounds. It's renowned for its diverse medicinal properties, such as being diuretic, anti-inflammatory, and antioxidant. These effects make parsley valuable in treating urinary tract disorders due to hypertension. But wait, how can this herb do so? Parsley can block the sodium-potassium ADPase, a pump found in the cells of the kidney tubules. This pump usually helps your body absorb sodium and potassium. but parsley can slow it down. As a result, more sodium and potassium stay in the kidney tubules instead of being absorbed back into your body. This makes the tubules more concentrated with these minerals. To balance things out, water from the cells flows into the tubules, making more urine. So, like dandelions, parsley makes you urinate more. This is why people with CKD should not take parsley. Let me repeat that. Parsley helps those prone to urinary tract infections or kidney stones. In a 2009 study published in the Brazilian Journal of Pharmacognosy, researchers investigated the diuretic effects of parsley extract on rats, reflecting its traditional use in Brazilian folk medicine. They tested this on 19 anesthetized Wista rats, giving them either filtered water or parsley extract by mouth. The rats given parsley extract showed higher urinary flow, more sodium and potassium in their urine, along with lower blood pressure. These effects may help take some workload off their kidneys. So, this study supports parsley's potential to improve kidney health. Parsley is a versatile and cheap way to add flavor to your dishes. To boost their flavor, you can use dried parsley in many recipes, like soups, stews, and tomato sauces. Fresh parsley is perfect for making homemade salad dressings, marinades, and seafood dishes. You can also add fresh sprigs to dishes that don't need cooking, or sprinkle them on at the end of cooking. To keep fresh parsley longer, wrap it in a damp paper towel, and store it in a closed container in the fridge. For those interested in the evidence, click the studies supporting our claims are provided in the link in our description box. 6. Turmeric. Turmeric, derived from the root of curcumilanga, contains curcuminoids like curcumin, which have been extensively studied for their therapeutic potential. Plus, research suggests that turmeric may have potential benefits for kidney health due to its anti-inflammatory and antioxidant properties. Also, traditional medicine uses turmeric for urinary tract infections, liver issues, and digestive disorders, further suggesting it could promote kidney health. Adding turmeric to your diet may offer a natural way to support overall kidney function and health. Plus, curcumin and turmeric can help improve gut health and counter inflammation. This can indirectly benefit the kidneys because a healthy gut and reduced inflammation can help decrease oxidative stress, which is often linked with chronic kidney disease, or CKD in short. Additionally, curcumin's anti-inflammatory properties may directly alleviate inflammation in the kidneys, potentially slowing the progression of CKD. One bonus point with curcumin is that it is easily absorbed by the body, making it highly effective in plasma, urine, and tissue. This quality is known as high bioavailability. In a 2022 meta-analysis in the Journal of Functional Foods, researchers investigated how taking curcumin affects blood creatinine levels in patients with inflammatory diseases. Creatinine is a waste product formed from muscle breakdown and is filtered by the kidneys and expelled in urine. So, more blood creatinine implies your kidneys are not working well to filter them, making them a key measure of kidney function. Analyzing 14 studies, scientists found that oral curcumin supplementation led to a significant decrease in creatinine levels. Notably, the positive impact was more pronounced in trials with longer durations when people took curcumin. This suggests that curcumin, the active compound in turmeric, could be crucial for promoting kidney health. So, unlike dandelion and parsley, turmeric is beneficial for CKD patients. However, if you have oxalate kidney stones, eat it in moderation. Turmeric is usually fine for other types of kidney stones, so it's best to ask your urologist about your specific type of stone if you have one. Studies typically recommend doses of 500 to 2,000 milligrams of natural turmeric or its extract per day for overall health. But there has not yet been a specific human study on kidney disease. You can get more curcumin from an extract than from natural turmeric. For example, the average Indian diet provides about 2,000 to 2,500 milligrams of turmeric per day, which equals around 60 to 100 milligrams of curcumin. Turmeric spices contain about 3% curcumin, whereas extracts contain around 95%. However, turmeric can still offer benefits when used as a spice. 5. Ginger. Ginger, originating in Southeast Asia and widely used as a spice and condiment worldwide, is a member of the Zingiberaceae family. This family comprises aromatic perennial herbs, such as ginger, turmeric, cardamom, and galangal. Among them, ginger's root has been utilized in traditional herbal medicine phytonutrients. Some of these compounds are gingerols, shogols, pyridols, and zingerone, which offer various health benefits. Additionally, ginger has anti-inflammatory, antioxidant, and antimicrobial properties, making it a versatile ingredient with potential health-promoting effects. Using ginger as a seasoning can prove beneficial effects, especially for kidney health. Ginger adds flavor to dishes without increasing sodium intake, which is crucial for individuals with chronic kidney disease, or CKD. By reducing salt intake and incorporating ginger into recipes, you can enjoy flavorful meals while helping your kidneys. Plus, ginger's anti-inflammatory properties may offer extra benefits for kidney function compared to salt. A systematic review in 2022 examined how ginger extract can protect the kidneys in diabetic kidney disease. The study looked at 41 articles and found that ginger supplementation significantly decreased blood glucose levels in 28 studies and reduced malondialdehyde, or MDA in short, levels in 9 studies. MDA is a type of biomarker that measures the amount of oxidative stress present in the body. So, a reduced MDA level through ginger supplementation suggests that ginger may effectively mitigate oxidative stress in the body, including the kidneys. Also, in several studies, ginger lowered serum creatinine, total cholesterol, and triglycerides, all of which benefits kidney health. This indicates the role of ginger in lowering blood sugar, lipid levels, inflammation, oxidative stress, and kidney injuries associated with diabetic kidney disease, highlighting its promising role in promoting kidney health. 4. Stinging nettle. Stinging nettle, a perennial herbaceous plant with spiny leaves, is native to the western United States and has been used in herbal medicine for centuries. Ancient Egyptians used it for arthritis and back pain, and Roman soldiers applied it to keep warm. Rich in fiber, minerals, vitamins, and antioxidants, stinging nettle has shown promise in promoting kidney function and cleansing. Its anti-inflammatory and antioxidant properties may help alleviate conditions such as urinary tract infections, or UTIs in short, and kidney stones. Plus, its diuretic effects can support flushing toxins from the kidneys. So, the use of stinging nettle as a remedy may offer a natural approach to supporting kidney health and cleansing. Also, stinging nettle can treat urinary symptoms of an enlarged prostate or benign prostatic hyperplasia, or BPH in short, in older men. In Europe, stinging nettle root is widely used for this purpose. Some research shows that stinging nettle is as effective as finasteride, a common BPH medication, in slowing prostate cell growth. Plus, studies suggest that stinging nettle, often combined with saw palmetto, can help with reduced urine flow, incomplete bladder emptying, post-urination dripping, and frequent urges to urinate. However, it's important to consult a doctor before using stinging nettle as a remedy for BPH. The ability of nettle to prevent kidney stone formation lies in its bioactive phytochemicals, such as flavonoids, anthocyanins, and saponins. These compounds inhibit calcium and oxalate buildup and crystal growth, which are the components of kidney stones. Some researchers investigated the antioxidant effect of nettle extract on male rabbits given gentamicin, a medication that can harm the kidneys. Gentamicin causes kidney damage and increased toxin levels in untreated rabbits. However, rabbits treated with nettle extract alongside gentamicin showed protective effects with no significant kidney damage observed. This suggests that nettle extract has a strong antioxidant ability and could play a crucial role in promoting kidney health by mitigating oxidative stress. Eating dried or cooked stinging nettle is usually safe with few side effects. However, be cautious when touching fresh stinging nettle leaves because their tiny hairs can sting your skin. Pregnant women should avoid stinging nettle as it might cause uterine contractions, which could increase the risk of miscarriage. 3. Juniper berries. Juniper berries, derived from the evergreen aromatic shrub Juniperus communis L., are rich in antioxidants and anti-inflammatory agents. This herb has been historically used for its diuretic, antiseptic, and anti-inflammatory effects. Juniper berry oil contains alpha-pinene, a potent compound with proven effects on both lab and animals. Juniper increases urine output without losing electrolytes, mainly due to its essential oil and hydrophilic components, which can easily dissolve in or interact with water. Specifically, terpenin 4-OL increases the glomerular filtration rate, or the rate of urine filtered. A 2020 study in the Clinical and Experimental Health Sciences investigated the effects of juniper berry oil on kidney dysfunction in diabetic rats. They divided 28 rats into groups, including rats untreated or treated with juniper oil. Results showed that diabetic rats treated with juniper oil had better kidney function compared to untreated rats. So, this study provides evidence of juniper berry's potential to improve kidney health and diabetic conditions by reducing oxidative stress and improving kidney function. However, excessive and prolonged use of juniper may irritate the kidneys, especially in cases of underlying kidney issues. However, studies showed mixed results, so if irritation does occur, it's important to consult a doctor for specific guidance. In this case, it would help if you cut down on the irritant, which is juniper. Plus, you can also drink plenty of water to alleviate the effects. Also, as juniper berries are diuretic or make you urinate more. Be cautious. Kidney disease patients often need to limit water intake to avoid water retention. Stop taking juniper berries if you notice any side effects. 2. Corn silk. Corn silk is the thin, shiny threads between the husk and ear of corn. Each ear of corn can have hundreds of these strands, which are essential for pollination and kernel growth. Corn silk, used in both Native American and traditional Chinese medicine, has been in human studies shown to lower blood pressure and help manage diabetes. Note that high blood pressure and diabetes are major risk factors for kidney disease. Extract from corn silk can also have a positive impact on kidney health by acting as a diuretic, increasing urine flow, and potentially preventing urinary tract and bladder infections. Additionally, it may help prevent kidney stones and protect against kidney damage from certain medications. Simply put, it contains bioactive compounds such as flavonoids, which contribute to its antioxidant capacity. Furthermore, corn silk has been studied for its potential to lessen kidney damage caused by substances like gentamicin, a common antibiotic known for causing kidney damage in some cases. While corn silk shows a protective effect against certain kidney injuries, higher doses may lead to toxins build up in the kidneys. You can add fresh corn silk into your diet as a topping on salads, potatoes, soups, and tacos. You can also use it to make corn silk tea by simmering fresh or dried corn silk in water for about 10 minutes, then letting it steep for an additional 30 minutes. After that, strain it and enjoy hot or cold. Cleavers, scientifically known as Gallium aperine, are a herbaceous plant rich in phytonutrients such as phenols, tannins, alkaloids, anthraquinones, coumarins, and flavonoids. Their diuretic properties, which can help increase urine flow and potentially support kidney function, are believed to aid in kidney cleansing. Additionally, some extraction of cleavers demonstrated strong antioxidant activity, particularly the aqueous fraction. Antioxidants can support kidney health by reducing oxidative stress, which is implicated in kidney damage, as we mentioned before. The high phenolic and flavonoid contents in the aqueous fraction contribute to its antioxidant properties, protecting against kidney damage caused by free radicals and oxidative stress. Therefore, incorporating cleavers, especially its extract, into a kidney cleansing diet could help promote kidney health. In 2006, a study from the Yasuj University of Medical Sciences looked at the kidney damage caused by cisplatin. This powerful anti-cancer medication is toxic to kidneys, and scientists wanted to see whether cleaver extract could help. The study was conducted using 70 rats randomly divided into groups. The rats were treated with different doses of cisplatin and cleaver extract, and their kidneys were examined. The results revealed that all drug-treated groups had increased mean glomerular volume, indicating kidney damage. However, groups receiving higher doses of cleaver extract showed less severe kidney enlargement. Thus, cleaver extract shows promise as a protective agent against cisplatin-induced kidney damage. With their sticky hooks, cleavers are best utilized in teas rather than consumed raw. Cleavers have also been traditionally used to treat conditions like cystitis. Precautions when using herbs for kidney cleanse. Now, we know that herbal medicine presents alternative therapies for various conditions, including chronic kidney disease, or CKD in short. However, caution is warranted as certain herbs, such as bergantia and asarum, contain aristolosic acid that can worsen kidney disease. The herbs we're suggesting today generally don't contain this substance and are generally safe. However, not all herbs are safe to use as therapy, so it's best to consult a healthcare professional before you use a new herb, especially if you have a health condition. This is because some herbs may interact with your current medications, especially anticoagulants, antihypertensives, and diuretics. They can either increase or decrease the effect of these medications. If you are taking these medications, consult your doctor for personalized advice. You should inform your doctor whether you use these herbs before or while taking these medications. This information is crucial, as it could lead to unexpected and potentially hazardous outcomes for you and your healthcare providers. Moreover, herbal supplements sourced from different countries may contain heavy metals, such as grains of solamine acid, posing a risk to kidney health. In some instances, herbal supplements can interact with prescription medications, potentially altering their effectiveness and impacting kidney function. Also, some herbs contain high levels of potassium or phosphorus, which should be restricted or added carefully under a healthcare professional's guidance for people with kidney disease, particularly those undergoing dialysis. Notably, some herbs function as diuretics, potentially aggravating or harming the kidneys, especially if their function is compromised. What is more, the FDA does not regulate herbal supplements for dosage, content, or purity. And there is limited research on how well they work, particularly in patients with kidney disease. Patients with kidney disease may have other health concerns from herbal supplements, such as bleeding disorders, which increase the susceptibility to adverse reactions. Special caution is advised for pregnant or lactating women and children. Certain herbs, like dandelion, parsley, and cleavers, support kidney health with their diuretic properties, while ginger adds flavor without salt. Turmeric's curcuminoids and stinging nettle can help prevent stone formation, and juniper berries and corn silk prevent urinary tract infections. To detoxify the kidneys, focus on hydration, a balanced diet, and limiting sodium intake. Those with kidney disease should be cautious of herb contents. Make sure to inform your healthcare provider about any supplements you're using. And if you're serious about mastering your health and understanding how the body works, make sure you subscribe to us, hit the bell icon, and turn on all notifications so you never miss a life-saving video. If you enjoyed this video, we believe you'll enjoy the video on the screen. Here, we share the 5 best fruits to help cleanse your kidneys and tips for using them. See you there. Stay informed. Stay healthy. 8 foods to eat if you have arthritis. Managing arthritis involves a comprehensive approach that encompasses medical care, lifestyle adjustments, and dietary choices. The foods we consume play a significant role in influencing inflammation, joint health, and overall well-being for individuals with arthritis. While there is no one-size-fits-all diet for managing this condition, certain foods have gained prominence for their potential to alleviate symptoms and support joint health. In this video, we delve into a selection of 8 foods that are often recommended for individuals with arthritis. These foods are celebrated for their anti-inflammatory properties, rich nutrient profiles, and potential to contribute to a holistic approach to managing arthritis. By integrating these foods into a well-balanced diet, individuals with arthritis can potentially take meaningful steps toward enhancing their quality of life and managing their symptoms more effectively. So, whether you're looking to fine-tune your diet, make informed choices, or simply learn more about the foods that can help you on your arthritis management journey, stick around as we uncover the science, benefits, and delicious ways to incorporate these foods into your routine. Now, let's jump into the world of arthritis. Friendly foods and discover how they can make a positive difference in your life. Just a quick reminder, this video is for educational purposes only. So speak to your doctor if you have any medical concerns. 1. Fatty fish. Fatty fish, such as salmon, mackerel, sardines, and trout stand out as nutritional powerhouses that offer significant benefits, especially for those dealing with arthritis. These fish are. Inflammation plays a pivotal role in the progression of arthritis, causing pain, swelling, and joint stiffness. Omega-3 fatty acids, particularly eicosapentaenoic acid, EPAE, and docosahexaenoic acid, DA, have been shown to help mitigate these symptoms. These essential fats not only help suppress inflammation by reducing the production of inflammatory molecules, but they also promote overall joint health. Omega-3s are believed to help maintain the integrity of joint cartilage and the fluid that cushions joints, thus potentially slowing down the degenerative process that occurs in arthritis. Additionally, consuming fatty fish can contribute to better cardiovascular health, potentially benefiting those with arthritis who are at an increased risk of heart problems. The American Heart Association recommends at least 2 servings of fatty fish per week to reap the benefits of omega. It's worth noting that cooking methods also matter. Grilling, baking, or steaming fatty fish is preferable over frying as it preserves the nutrient content without adding unhealthy fats. Incorporating fatty fish into your diet can be a flavorful and healthful way to lose weight. Transcripts provided by Transcription Outsourcing, LLC. 2 berries, including blueberries, strawberries, raspberries, and more, offer a vibrant and delicious way to potentially alleviate arthritis symptoms. Packed with antioxidants, vitamins, and minerals. These tiny fruits can play a significant role in reducing inflammation and supporting overall joint health. The key components of berries that make them valuable for arthritis management are their high content of anthocyanins and other polyphenol. These compounds possess powerful antioxidant and anti-inflammatory properties. Anthocyanins, responsible for the rich colors in berries, have been linked to reduced levels of inflammatory markers in the body. Moreover, the vitamins found in berries, such as vitamin C, play a role in collagen production, an essential component of joint tissue. By supporting collagen synthesis, berries can contribute to maintaining healthy joints and potentially slowing down the progression of arthritis. Berries also offer a low-calorie, high-fiber option for those looking to maintain a healthy weight. Excess weight can exacerbate arthritis symptoms as it places additional stress on the joints. On joints, incorporating berries into a balanced diet can assist in weight management, while providing essential nutrients. Whether enjoyed on their own, added to yogurt, oatmeal or smoothies, or incorporated into various recipes, berries provide a delicious and versatile way to enhance your arthritis management plan. 3. Leafy greens. Leafy greens such as spinach, kale, Swiss chard, and others emerge as nutritional champions for individuals grappling with arthritis. Packed with an array of vitamins, minerals, and antioxidants, these verdant vegetables offer a host of benefits that can contribute to better joint health and potentially alleviate inflammation. Rich in antioxidants like vitamin C, beta, and carotene and vitamin E. Leafy greens help combat the oxidative stress that accompanies inflammatory conditions like arthritis. These antioxidants work to neutralize harmful free radicals, reducing cell damage and inflammation. Additionally, leafy greens are brimming with essential nutrients like calcium and magnesium, which are crucial for maintaining bone health. Strong bones provide a sturdy foundation for healthy joints, making these greens particularly valuable for those with arthritis as the condition can affect bone density. The presence of vitamin K in leafy greens further supports bone health by aiding in calcium regulation. Adequate vitamin K levels are essential for proper calcium utilization, which in turn can help maintain bone integrity. The high fiber content in leafy greens aids in digestion and can contribute to a healthy weight. Another crucial aspect of arthritis management, maintaining a healthy weight can alleviate stress on joints and minimize inflammation. Whether sautéed, blended into smoothies, or used as the base for salads, leafy greens are a versatile addition to any diet. Integrating leafy greens can be a nourishing way to support your joint health and overall well-being. Nuts and seeds. Encompassing varieties like walnuts, almonds, chia seeds, and flax seeds offer a wealth of nutritional benefits that can be particularly advantageous for individuals grappling with arthritis. Laden with essential nutrients, healthy fats, and potent anti-inflammatory compounds, these tiny powerhouses can play a significant role in managing inflammation and promoting joint health. The omega-3 fatty acids present in nuts and seeds, while not as abundant as in fatty fish, still offer valuable anti-inflammatory effects. Alpha-linolenic acid, a type of omega-3 found in these foods, has been associated with reduced levels of inflammatory. Furthermore, nuts and seeds are rich sources of vitamin E, a potent antioxidant that helps combat oxidative stress and protect cells from damage. This antioxidant support can be especially relevant for people with arthritis, where oxidative stress is often heightened. The polyphenol and phytochemicals found in nuts and seeds, including flavonoids and lignans, contribute to their anti-inflammatory properties. These compounds have been linked to the reduction of inflammatory processes in the body. Fiber content is another boon of nuts and seeds, aiding in digestion and promoting a feeling of fullness. Maintaining a healthy weight through portion-controlled consumption can alleviate strain on joints and reduce inflammation. Incorporating nuts and seeds into your diet can be as simple as enjoying them as snacks, sprinkling them on yogurt or salads, or using them as ingredients in various dishes. By adding nuts and seeds, you can savor their nutritional benefits while potentially supporting your arthritis management journey. 5. Whole grains. Whole grains, such as whole wheat, brown rice, quinoa, and oats, offer a substantial arsenal of nutrients that can be particularly advantageous for individuals dealing with arthritis. Whole grains packed with fiber, vitamins, and minerals, these grains contribute to overall well-being and potentially aid in managing inflammation associated with arthritis. The fiber content in whole grains supports digestive health and can help regulate blood sugar levels. This can be especially beneficial for individuals with arthritis, as maintaining stable blood sugar levels can potentially alleviate inflammation and reduce the risk of metabolic complications often linked to the condition. Whole grains are a good source of B vitamins, such as B6, bind, folate, and B3 niacin. These vitamins play a role in cell metabolism and energy production, while folate supports the production of DNA and RNA, important for cell growth and repair. Moreover, the minerals found in whole grains, including magnesium and selenium, contribute to various bodily functions. Magnesium in particular supports muscle and nerve function and aids in maintaining bone health, critical for those managing arthritis. The complex carbohydrates in whole grains provide a sustained release of energy, promoting stable blood sugar levels, and potentially reducing the risk of weight gain, a factor that can exacerbate arthritis symptoms. Incorporating whole grains into your diet can be as simple as choosing whole grain bread, brown rice, or whole wheat pasta over refined options. However, individual sensitivities and dietary restrictions should be considered. Consulting with a healthcare provider or registered dietitian is advisable, especially if you have celiac disease, gluten sensitivity, or other health conditions. By incorporating whole grains, you can embrace their nutritional benefits while supporting your joint health and overall vitality. 6. Turmeric. Turmeric, a vibrant yellow spice derived from the curcumulanda plant, has gained significant attention for its potential anti-inflammatory and antioxidant properties, making it a popular choice for individuals managing arthritis. The active compound in turmeric, curcumin, is responsible for its powerful effects. Curcumin has been studied for its ability to inhibit the production of inflammatory molecules and enzymes that play a role in the progression of arthritis. Numerous research studies have suggested that curcumin's anti-inflammatory effects are comparable to certain non-steroidal anti-inflammatory drugs I anticipate, but without the potential side effects often associated with these medications. Furthermore, curcumin's antioxidant properties help combat oxidative stress, a key contributor to inflammation and tissue damage in the body. In arthritis, by neutralizing free radicals, curcumin supports joint health and potentially slows down the degenerative processes. It's worth noting that curcumin's bioavailability can be limited when taken alone. However, pairing turmeric with black pepper, which contains piperine, can enhance its absorption and effectiveness. Turmeric can be incorporated into your diet by adding it to curries, soups, stews, and even smoothie. Additionally, turmeric supplements are available, but consulting with a healthcare provider before introducing them into your routine is recommended, especially if you have underlying health conditions or are taking medications. While turmeric shows promise as a natural remedy for arthritis, individual responses can vary. Integrating turmeric as part of a balanced diet and lifestyle under the guidance of a healthcare professional can potentially provide anti-inflammatory benefits and aid in arthritis management. 7. Ginger. Ginger, a pungent and flavorful root, is renowned for its potential anti-inflammatory and analgesic properties, making it a noteworthy addition to the diets of individuals dealing with arthritis. The active compounds in ginger, such as gingerol and other bioactive molecules, are believed to contribute to its medicinal effects. These compounds have been studied for their ability to inhibit inflammatory pathways, potentially providing relief from arthritis, related pain, and swelling. Ginger's analgesic properties can be particularly valuable for those seeking natural pain management options. Some research suggests that ginger may help reduce pain perception by interacting with pain receptors in the body. Furthermore, ginger's antioxidant properties help counteract oxidative stress and reduce inflammation, supporting joint health. Its ability to modulate the immune response may also contribute to its anti-inflammatory effects. Ginger can be easily incorporated into your diet by adding it to various dishes, such as stir-fries, soups, or smoothies. Ginger tea is another popular option, offering warmth and potential pain relief. Adding ginger as a spice or herbal remedy can be a flavorful and potentially beneficial way to manage arthritis symptoms. However, individual responses can vary, and professional guidance is essential for determining the most suitable approach to integrating ginger into your arthritis management plan. 8. Extra virgin olive oil. Extra virgin olive oil, celebrated for its heart, healthy monounsaturated fats, and potent antioxidants, emerges as a valuable option for individuals navigating arthritis. Its potential to reduce inflammation and contribute to overall well-being makes it a desirable addition to an arthritis-friendly diet. The monounsaturated fats in olive oil are particularly oleic acid have demonstrated anti-inflammatory effects. These fats can help modulate the body's inflammatory processes, potentially easing arthritis symptoms like pain and swelling. Olive oil also contains antioxidants such as vitamin E and polyphenol, which combat oxidative stress. Oxidative stress is a driving force behind inflammation and tissue damage in arthritis, making these antioxidants beneficial for supporting joint health. Solve for more. Extra virgin olive oil is a source of healthy fats that can aid in weight management. Maintaining a healthy weight is crucial for individuals with arthritis, as excess weight places added stress on joints, exacerbating symptoms. Using extra virgin olive oil as a primary cooking oil or as a dressing for salads and vegetables can easily incorporate its benefits into your diet. However, portion control is important. As olive oil is calorie-dense, it's important to note that not all olive oils are created equal. Extra virgin olive oil, obtained through minimal processing, retains the highest levels of antioxidants and beneficial compounds. When purchasing olive oil, opt for reputable brands that display the extra virgin label. By incorporating extra virgin olive oil into your meals, you can potentially harness its anti-inflammatory properties and contribute to your arthritis management efforts. Summary: in the realm of arthritis management, the foods we choose to consume can play a crucial role in alleviating symptoms and promoting joint health. This video delves into everything. 8 highly recommended foods for individuals dealing with arthritis, offering insights into their anti-inflammatory properties and nutritional benefits. From the omega-3 fatty acids in fatty fish, such as salmon and mackerel, to the potent antioxidants found in berries, like blueberries and strawberries. These foods show promise in reducing inflammation and oxidative stress. Leafy greens like spinach and kale contribute essential vitamins and minerals to support joint health. Nuts and seeds, like walnuts and chia seeds, contain anti-inflammatory compounds and healthy fats, while whole grains provide fiber, vitamins, and minerals to the body that aid digestion and bone health. Turmeric, with its active compound, curcumin, has garnered attention for its potent anti-inflammatory and antioxidant effects. Ginger, another notable spice, boasts natural analgesic and anti-inflammatory properties, making it a potential ally in managing arthritis-related pain. Extra virgin olive oil, rich in monounsaturated fats and antioxidants, can contribute to reducing inflammation and supporting heart health. However, individual responses to these foods may vary, making it crucial to consult healthcare professionals or registered dietitians before making significant dietary changes. By incorporating these arthritis-friendly foods into your diet, you can take meaningful steps toward managing symptoms and enhancing your overall quality of life. Remember to maintain a balanced diet, stay informed, and tailor your choices to your unique health needs. We hope this video has shed light on the potential benefits of incorporating these foods into your diet and inspired you to take proactive steps in managing your arthritis. If you found this information valuable, don't forget to give us a thumbs up, share with others who might benefit, and subscribe to our channel for more insightful content. Thank you for joining us on this journey of discovery. And remember, when it comes to arthritis management, every bite counts towards a healthier, more comfortable future. Don't forget to hit that subscribe button and the notification bell so you never miss an update from us. Stay informed. Stay empowered. And here's to your well-being. Until next time. Avoid these 6 common foods that can destroy your kidneys. Our kidneys play a super crucial role as a toxin filter and are essential for survival. Since healthy kidneys filter about half a cup of blood every minute, without proper kidney function, waste products and toxins can build up in our bodies. Now, this is something you may not know. Kidney damage is mostly irreversible, especially chronic ones. Let me repeat that. You can't fix kidney damage in most cases. What's even more concerning is that if left untreated, this damage can progress to kidney failure. That means you might need dialysis or even a kidney transplant to stay alive. Shockingly, about 1 in 3 people with seriously weakened kidney function, yet not on dialysis, are unaware that they have kidney disease due to vague symptoms. So, you'd better take preventive steps before it's too late. Did you know that some foods we eat daily can silently harm our kidneys? In this video, we will mention 6 common foods that could slowly damage our kidneys over time. Trust me, some of them will shock you. We will also share tips for eating these foods carefully to protect our kidneys. Before we dive in, kindly note that all information you'll find in this video is fact-checked, unbiased, and reviewed by qualified professionals. Alright, it's time to swing back to the foods that can destroy your kidneys. 6. Spinach. Spinach has long been marketed as a super healthy food, but the truth is that it's high in oxalate, a known kidney killer. 100 grams of spinach can contain up to 1,260 milligrams of oxalate, which is higher than what you'd get from many other leafy greens. If your body takes too much oxalate in a short period of time, even with a moderate daily intake, you can accumulate oxalates in your body, causing kidney stones, bladder stones, kidney nephropathy, joint issues, and affecting every organ, including the brain. They are also linked to conditions like interstitial cystitis, also known as painful bladder syndrome. Cassava root, chard, and rhubarb are also notable for their high oxalate content, so it's best to avoid them. Another concern with spinach is that it is rich in potassium. Normally, healthy kidneys balance potassium levels in the blood. But for people with chronic kidney disease, or CKD in short, it's important to control potassium intake. The National Kidney Foundation suggests limiting it to 2,000 milligrams daily for CKD patients. However, just 100 grams of uncooked spinach can have as much as 558 milligrams of potassium. Be mindful that potassium or oxalate content remains unchanged when boiling spinach. So, if you have kidney disease, eating spinach in moderation is wise. You can enjoy spinach along with other veggies like kale, carrots, zucchini, lettuce, cabbage, broccoli, and cauliflower, which are lower in oxalate and potassium. 5. Potatoes and sweet potatoes. Sweet potatoes are rich in essential vitamins, minerals, and amino acids, making them a superfood. But watch out for their high potassium content, which is bad for people with kidney disease. According to the United States Department of Agriculture, or USDA, a regular baked potato has around 610 milligrams of potassium, while a sweet potato of about 5 feet in length can have 438 milligrams. However, unlike spinach, soaking potatoes in water before cooking can help reduce their potassium levels. So, it's wise to be moderate and soak your potatoes and sweet potatoes before cooking for the sake of your kidneys. Moreover, popular snacks from potatoes, such as French fries or chips, are high in sodium or salt, putting more strain on your kidneys. Snacking on them can easily push you over your daily sodium limit. Plus, potato chips usually offer little or no nutritional value, as they are highly processed. So avoiding them all is best. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. Rice is the dependable sidekick to countless meals worldwide. But guess what? That innocent plate of rice might carry a toxic surprise. Simply put, rice is high in arsenic, the heavy metal that directly damages your kidneys. Arsenic poisoning can lead to problems like acute renal failure and chronic renal insufficiency. In raw rice, the more harmful form of arsenic, called inorganic arsenic, is about 0.1 to 0 for milligrams per kilogram. For other grains like wheat and barley, the inorganic arsenic is often undetectable, and their total arsenic content is only 0.03 to 0.08 milligrams per kilogram. Rice also tends to absorb more cadmium and other heavy metals than other crops. Does it mean that you should avoid all rice? Not necessarily. You can still enjoy it in moderation because a healthy diet is about balance. It's fine to have rice occasionally, but it's best not to have it too often, especially for infants and children. They can get up to 3 times more arsenic from rice than adults. So even low levels of exposure could affect children's brain development, intelligence, and memory. If you're considering alternatives to brown rice, try these low arsenic options: quinoa, barley, couscous, buckwheat, millet, farro, and sorghum. 3. Butter. Butter is a dairy product made from milk or cream's fat and protein components. Thus, this creamy treat is composed of saturated fat and cholesterol. These compounds are linked to high blood pressure and plaque formation, which can strain your kidneys' blood vessels and impair kidney function over time. If it was not harmful enough, we have salted butter too. 100 grams of salted butter contains about 643 milligrams of salt, and that is a lot. A high sodium diet will increase blood pressure, which may result in kidney damage in the long run. Moreover, store-bought butter is often heavily processed to improve flavor and extend shelf life. This process removes vital nutrients like calcium from butter, resulting in minimal nutritional benefits. So, consider opting for organic, unsalted butter to support your kidney health. And remember, moderation is key. 2. Soda. Consuming sugar in liquid form is way more harmful than in solid form. And soda is nothing but sugar. When your blood sugar is too high, your kidneys start to spill sugar into the urine. If your kidneys are healthy, this usually isn't a problem. But if you have diabetes, too much sugar can cause kidney damage. Simply put, kidneys have tiny filters called nephrons. High blood sugar from diabetes can damage these filters and blood vessels, making the kidneys struggle. People often go for diet soda, thinking it contains a lesser amount of sugar. But what they do not know is that drinking diet soda every day is linked to a 67% higher risk of developing type 2 diabetes. Diet soda still contains additives and artificial sweeteners that actually damage your kidneys. More concerning, sodas often contain high phosphorus additives for flavor and a longer shelf life. Too much phosphorus can seriously harm your kidneys. Compared to natural sources, phosphorus from sodas is absorbed to a greater extent. The National Kidney Foundation suggests sticking to 700 milligrams of phosphorus per day for normal kidney function. Now, to protect your kidneys, it's best to cut back on soda intake. 1. Dried fruits. Dried fruits are tasty and seemingly nutrient-dense since they remove water content. However, they're also rich in potassium, sugar, and calories, which might be bad for your kidneys. According to the USDA, 1 cup of pitted uncooked prunes contains 1,270 milligrams of potassium, which is enough to meet half the requirement of a day. Moreover, some dried fruits also contain added additives, salt, and sugar to enhance flavor. These components will add more stress to your kidneys when they filter the blood. If you consume dried fruits daily, you may overwork your kidneys. It's also easy to overeat dried fruits since they're small and convenient for snacking, which can lead to consuming more calories than you think. Plus, the dehydration process removes much of the water from the fruit, so you may not feel as full as you would with fresh fruit. So, it's best to stick with fresh fruits as a snack if you want to protect your kidneys. And there you have it, folks. Our list of 6 common foods that can destroy your kidneys. They are spinach, potatoes, and carrots. Rice, butter, soda, and dried fruits. More foods that aren't good for your kidneys include canned or frozen items, GMOs, tomato sauce, and concentrated juice. They are full of salt and added sugar. By avoiding them or practicing moderation, you will take the first step toward a kidney-friendly lifestyle. If you want to remember better, here's a tip. Write down the list of foods to watch out for your kidney health to test your memory. Now, we want to give a big thank you to all our current subscribers and supporters. Your support inspires us to continue sharing top-notch health tips and information to you. On our channel, you'll find many helpful videos about eating tips to naturally boost your health and insights into diseases. To explore more interesting food lists, check out the playlist on the screen, and you'll discover smart food choices to take care of your brain, heart, and other organs. We'll also give you tips to enjoy these foods for the maximum benefits. Stay informed. Stay healthy.